All right, I'm going to welcome everybody into another episode of the Fox Experience. Thanks so much for tuning in. I'm going to take this episode to go over coronavirus / COVID-19, whatever you'd like to call it. And I'm going to go over some numbers, a petition that's circulating around that's been signed by hundreds of thousands of doctors and epidemiologists about the harms of further lockdowns and how we should approach reopening. I'm also going to go over some numbers comparing the overall deaths within the last 7 to 8 months versus how many of those deaths were with COVID. I'm going to go over these numbers because I want to show everybody that dying with the coronavirus in certain age groups, especially under 54 years old, the rates of people dying with COVID compared to the overall deaths of people within those age groups is minuscule compared to the overall landscape and overall rhetoric of everybody in the media or politicians basically saying if you go outside, you're going to die. If you don't wear a mask, you're going to die. If you go to a rally, you're going to die. If you riot and protest, you're not going to die, because the virus, of course, is aware of racial inequality and what people are protesting or celebrating or gathering for. And I'm going to wrap it up with the WHO doing another 180 on their stance on the coronavirus and on lockdowns. Kick back and enjoy the show. I can't wait to share all of this information. Petition, again, circulating that has hundreds of thousands of signatures on it about the dangers of continuing these lockdowns and how we should approach reopening. Also, I'm going to go over those numbers of overall deaths compared to those deaths that have occurred with COVID. And then the WHO does another flip-flop on their stance on the coronavirus and on lockdowns. Kick back, enjoy, and let's get right into this new episode of the Fox Experience on the coronavirus and on the WHO. I'm going to go ahead and start off with a petition that is circulating that has been drawn up and endorsed by thousands of doctors. I will give you those numbers in a moment. This is called the Great Barrington Declaration, and it starts off with, as infectious disease epidemiologists and public health scientists, we have grave concerns about the damaging physical and mental health impacts of the prevailing COVID-19 policies and recommend an approach we call focused protection. It starts with, coming from both the left and right and around the world, we have devoted our careers to protecting people. Current lockdown policies are producing devastating effects on short and long-term public health. The results, to name a few, include lower childhood vaccination rates, worsening cardiovascular disease outcomes, fewer cancer screenings, and deteriorating mental health, leading to greater excess mortality in years to come, with the working class and younger members of society carrying the heaviest burden. Keeping students out of school is a grave injustice. It continues, keeping these measures in place until a vaccine is available will cause irreparable damage, with the underprivileged disproportionately harmed. Fortunately, our understanding of the virus is growing. We know that vulnerability, the death from COVID-19, is more than 1,000-fold higher in the old and infirm than the young. Indeed, for children, COVID-19 is less dangerous than many other harms, including influenza. As immunity builds in the population, the risk of infection to all, including the vulnerable, falls. We know that all populations will eventually reach herd immunity, i.e., the point at which the rate of new infections is stable and that can be assisted by but is not dependent upon a vaccine. Our goal should therefore be to minimize mortality and social harm until we reach herd immunity. The most compassionate approach that balances the risks and benefits of reaching herd immunity is to allow those who are at minimal risk of death to live their lives normally, to build up immunity to the virus through natural infection while better protecting those who are at higher risk. We call this focused protection. The petition continues, adopting measures to protect the vulnerable should be the central aim of public health responses to COVID-19. By way of example, nursing homes should use staff with acquired immunity and perform frequent PCR testing of other staff and all visitors. Staff rotation should be minimized. Retired people living at home should have groceries and other essentials delivered to their home. When possible, they should meet family members outside rather than inside. A comprehensive, detailed list of measures, including approaches to multi-generational households, can be implemented and is well within the scope of capability of public health professionals. Those who are not vulnerable should immediately be allowed to resume life as normal. Simple hygiene measures such as hand washing and staying home when sick should be practiced by everyone to reduce the herd immunity threshold. Schools and universities should open for in-person teaching. Extracurricular activities such as sports should be resumed. Young, low-risk adults should work normally rather than from home. Restaurants and other businesses should open. Arts, music, sport, and other cultural activities should resume. People who are more at risk may participate if they wish, while society as a whole enjoys the protection conferred upon the vulnerable by those who have built up herd immunity. This petition was authored and signed in Great Barrington, United States on October 4th, 2020. Just to recap a few of the points of the long-term effects of these continued lockdowns. The results include lower childhood vaccination rates, worsening cardiovascular disease outcomes, fewer cancer screenings, deteriorating mental health. The most compassionate approach that balances the risks and benefits of reaching herd immunity is to allow those at minimal risk of death to live their lives normally to build up immunity to the virus through natural infection while better protecting those at highest risk. This petition, as of October 9th, was signed by 6,005 medical and public health scientists, 12,307 medical practitioners, and over 169,000 people from the general public signed on to this declaration. If you're interested in this declaration and this petition and signing it and reading up on it, it is from Great Barrington. It is at G as in girl, B as in boy, declaration.org. It lets you read the declaration, it lets you sign the declaration. You can read right through it. It's a very simple read. I just read the majority of it to you. I think it's a really good thing to have out there that, the continued lockdowns are going to have more long-term effects than people just staying at home. I know it's been 7-8 months that people have been locked down. Kids that aren't in in-person schooling, it is just a travesty to them, and I feel like they're being robbed of part of their childhood. And for someone like me who lives with a mental illness, it has definitely had an effect on me at times. There were, days and, a week here or 2 weeks there where I was completely down in the dumps. I didn't feel like there was anything positive going on. I was looking for meaning in just the simplest of things. Even someone like me who has a job, full-time job, lives a life where I'm not really affected too much by my mental illness since I have it under control. And for someone like myself to go through these depressive states and to go through these, down in the dumps feelings over being locked down over something that you feel is not justified, it really puts you in a bad way. And I know for myself with, my nephew, for example, and his stepbrother and stepsister, they are not in school. They're doing their schooling at home. They live in the Northwest, and it's really disheartening to hear them say, I just want to be in school. My nephew plays soccer, and he can't play soccer. He wants to play flag football, and they can't play flag football. It's something that these kids are really being robbed of a lot of their childhood. They were already robbed of their summer, and keeping them out of school any longer is just going to be a detriment and an overall negative impact on them when it comes to them being successful members of society. And I'm not saying that these continued lockdowns are going to set them up for failure, but these continued lockdowns are not going to help these children and these kids and high school kids and even college kids that were supposed to graduate or were going into their freshman year of college. I'm not saying that continued lockdowns will doom them for the rest of their lives, but robbing them of a year or half a year or a year and a half, whatever it may be in the end, robbing them of that much time in this critical stage of their life where they're developing, it's an absolute travesty. And I greatly encourage everyone to go to the Great Barrington Declaration, gbdeclaration.org, to read up on this petition. And you can sign the petition if you'd like. Over 169,000 people from the general public have already signed it, over 6,000 medical and public health scientists, and over 12,000 medical practitioners. The Great Barrington Declaration, something that's been put out there and I think makes a lot of great, obvious points, something that should be read and something that should be spread far and wide. What's up, everybody? This is JP Fox with the Fox Experience. Just want to take this opportunity to thank you for checking out the show. You can check it out on any of the podcast platforms. We are everywhere: iHeart, Apple Podcasts, Google Podcasts, Spotify, SoundCloud, and all other platforms. Check out the show on Twitter at The Fox Experience. Find me on Twitter at _JP Fox. You can even check me out on Facebook at facebook.com/JP Fox Media. With the podcast on any of the platforms, you can rate, review, help spread the word. Any rating, any review really gets the show out there and really helps spread the word. Again, you can find us on any platform: iHeart, Apple, Google, and all other podcast platforms. Rate, review, share. Check us out on Twitter. I'm looking forward to providing everybody with a podcast that they can relate to, that they can share, that they can listen to, no matter what background you're from. And I hope the Fox Experience is something to make part of your routine. All right, next I want to go over some numbers on COVID deaths versus overall deaths in the United States over this same period of time. Now, this isn't to be morbid. This isn't to say anybody's life is more valuable than the other or any death is worse than the other. But what I am saying is we have to look at the data, we have to look at the science, and we have to look at everything as a whole and start making some educated and informed decisions. With this, I'm going to share this information on the deaths age stratification in the United States due to COVID-19. This is a chart that was provided by Phil Kerpen on Twitter at Kerpen, Kerpen. He shared some data from the CDC on the COVID deaths, and also the population is from the CDC, wonder.cdc.gov/population. Now, the data that I'm going to share with you is the total deaths of an age group compared to the COVID deaths of that same age group over the same period of time. This is from February 1st, 2020 to October 3rd, 2020, and these numbers are as of October 7th. The total deaths from the age of under 1 year old to 54 years old, so under 1 to 54 years old. In this period of time, there has been 279,019 total deaths among these age groups combined. Of those 279,000 total deaths, 16,638 were due to COVID. Now, this is saying deaths with COVID, not necessarily due to COVID. So again, since February 1st to October 3rd, there have been 279,000 deaths among the age groups of under 1 year old up to 54 years old. And out of those deaths, 16,638 have been with COVID. That equates to 5.9% of all deaths among those age groups, which is under 1 year old to 54 years old. Out of all of the deaths that have happened since February 1st, 5.9% of the cumulative deaths have been people that have died with COVID. I think it's a very startling statistic, and it puts things into perspective. And when people say that the younger population is at less risk and at less risk of serious problems or death, it is extremely low. It's near zero in a lot of these age groups. Now, it does seem like a lot when you say 16,000 people in these age groups have died. But when you say 280,000 total deaths have occurred within these age groups, and in the same period of time, 16,000 of them have been with coronavirus, it kind of puts a little bit into perspective of how dangerous is this virus. Obviously, it's dangerous, but in the younger populations, as you can see, it is extremely low compared to the other reasons that these people are dying. Now, what do you do with this data? What you do with this data is look at it and say, okay, the people in these populations of younger people are at way less risk of dying with coronavirus than not dying with coronavirus. Exponentially, it's a heck of a lot more. It's almost 94%. Now, when we look at that and say, okay, 94% of the total deaths between these age groups of under 1 year old to 54 years old, if 94 of the deaths are people that have died without COVID, why are we going to lock down the entire population? Why are we going to lock down these kids? And why are we not going to let them go about their normal lives when a small percentage of the people that have died within the last 7 months or so have died with COVID? And now, also in this chart, it doesn't say that it has died due to COVID. Now, you can go to Worldometers, which is from Johns Hopkins U, and they track everything daily from states, countries, counties, all over the place. This chart is just saying the people that have died with the coronavirus. I think that this chart is something that everybody needs to look to, and when politicians and people out there say, listen to the science, listen to the data, look at the facts, well, these are the facts. This is from the CDC. Everybody preaches about the CDC and the WHO, which I'm going to get into as well. You need to start saying, okay, the data that they're putting out isn't supporting the position that they are standing on. So I think people need to start doing their own research, start doing their own data collection, and start making their own decisions on these things and abide by your state's guidelines if you still have restrictive policies. I know in a lot of blue states they do. In Arizona, where I live, not so much. But I think it's a very telling statistic right there that only 5.9% of the total deaths within this period of time among the ages of under 1 year old to 54 years old, under 6% of them have died with coronavirus, and that doesn't specify whether they died due to coronavirus. Take this data as you wish, pass it on, and I think it's very telling of the minimizing of the other dangers in the world not COVID related. If 279,000 total people have died and less than 6% of them have been with COVID, we should start learning how to reopen. We should start learning to live with the virus, because you are exponentially more likely to die without COVID than dying with COVID if you're under 1 year old up to 54 years old. We need to protect the vulnerable, but we need to let the younger population that is at less risk of having serious complications or dying from the virus, we need to let them, myself included, and people like myself and people in my situation or age group, or even just people that want to get back to work in a regular way, we need to start saying, okay, look at this data. I'm way more at risk of dying from something else other than COVID, and let's get this ball rolling on getting the country back open. Now, one of the most frustrating things about this pandemic is the uncertainty of all of the medical experts that claim to know everything about this virus. Now, when this began, we were told this was a novel coronavirus, which meant that it was brand new. Everyone had to kind of learn on the fly and learn how to treat this virus since it had never been seen before. Also, another frustrating part of this, and I think this is the most frustrating part, is that the pandemic and the coronavirus have become extremely political. No matter what the administration has done, and no matter what your opinion is of the president has done an amazing job of helping states that were in need of big-time help. Case in point, New York. In New York, they were literally losing people by the hundreds and even, I believe, the low thousands. I can correct that if I'm wrong, in the early stages of this pandemic. One of the main reasons for that is the decision that is now being denied by New York Governor Andrew Cuomo. Andrew Cuomo's decision to send COVID-positive patients back into nursing homes, which led to an extremely high number of nursing home deaths in the state of New York. Also, with this pandemic, on October 12th, Governor Cuomo of New York had said that he was still considering extending lockdowns for the state of New York. The day before he made that statement, on October 11th, New York had a total of 5 deaths related to COVID. So again, the governor of New York, who made the decision months ago to send COVID-positive people back into nursing homes, which wiped out a huge portion of the nursing home population in the state of New York, he said that he was still considering further lockdowns a day after the entire state lost 5 people due to the coronavirus. Also in the state of Michigan, Gretchen Whitmer, governor of Michigan, sent 20 and 30-year-olds that had COVID into nursing homes, which led to a spike and a very high number of nursing home and elderly patients that died from COVID. One of the most frustrating parts about this part is that Gretchen Whitmer and Andrew Cuomo pretend like the nursing home situations never happened. Andrew Cuomo, who signed an executive order in May ordering people back into nursing homes no matter if they're positive or negative. Once people found out about this and started digging into it a bit, there was an executive order that was scrubbed from Andrew Cuomo's website, or the website for the New York Department of Health. That document disappeared off the internet. But one thing that some politicians or some people don't realize is that once it's on the internet, it's on there forever. So we have an executive order that was signed by Andrew Cuomo saying that these COVID-positive patients can go back into nursing homes. Also, Gretchen Whitmer, there is an executive order that she signed in the state of Michigan that stated people can go back into nursing homes no matter if they're positive, which included 20 and 30-year-old patients that were positive for COVID. In Michigan, they needed room for these patients, and they decided to put them into nursing homes. That's disgusting. That doesn't make any sense. And it led to a catastrophe of thousands of more deaths than there needed to be. Also, the CDC, the Centers for Disease Control, and the WHO, the World Health Organization, cannot seem to make up their minds on the lockdown. Since the very beginning of this, the WHO has flip-flopped time after time after time after time. First, they said it was not airborne, the coronavirus. Then they said it was not transmitted human to human. Then they said that masks were bad. Then they said masks were good. They also said that lockdowns were justified to contain the spread of the coronavirus. And now they have flip-flopped again, saying that now we should never use lockdowns, and they are condemning and going back on their word that were saying the lockdowns were justified, and now they're saying the lockdowns were a huge mistake. The WHO has made this decision. Also, in March, Dr. Fauci, who is Lord Fauci to so many in the nation, in March on 60 Minutes, he said, "You do not need a mask. You do not need a mask right now. It does not help. It'll maybe stop a droplet or so." And really does nothing, and people should not be wearing masks. There's no reason for people to be wearing masks. Also, and I pointed this out on an earlier episode, Surgeon General Jerome Adams at the end of February tweeted out, and again I pointed this out on an earlier episode, from his official Twitter account as the Surgeon General of the United States. "Seriously, people," and then in all caps, "stop buying masks. They are not effective in preventing general public from catching coronavirus. But if healthcare providers can't get them to care for sick patients, it puts them and our communities at risk." Now, I'm not saying that this man, Jerome Adams, the U.S. Surgeon General, knew everything that he was talking about at the time. And I don't think a lot of doctors knew what they were talking about at the time, since this was a novel coronavirus. We are now in October. We are now 7 to 8 months into this, where we know exponentially more about this virus and how to treat it. But when Dr. Fauci, who is being trotted out as an expert on all of this, is telling us not to wear masks and that we should be living our lives as normal, and then when the Surgeon General says stop buying masks because they do not prevent the spread of coronavirus, what are we supposed to believe? We have Dr. Fauci, who has done incredible work in the past on the AIDS epidemic that struck the nation in the 80s and 90s. And then the Surgeon General of the United States, who is the operational head of the U.S. Public Health Service Commissioned Corps, and thus leading spokesperson on matters of public health in the federal government of the United States, when they are both telling us to not wear masks, they're telling us to stop buying masks, and then months later, all of a sudden we have mask mandates all around the nation. It's really hard to trust these people, and not in an overall fact of we shouldn't be able to trust them at all. It's just trusting them in stop telling us things if you don't know what's going on. And also in previous episodes where I did a lot of coverage on the coronavirus, I did say no one knew about this in the beginning. We were all learning as we go, including the health professionals. Epidemiologists had never seen this virus. The Surgeon General had never seen this virus. Dr. Fauci had never seen this virus. So early on, when they were telling us to not wear masks, when they were telling us we should live our lives as normal, what were we supposed to do then? Because if we didn't do that then, would we have all been criticized? Would we have all been called grandma killers, which has become, the new punchline if you don't wear a mask? Honestly, I think it would have been the opposite. I think if we all started wearing masks, they would have been criticizing us, which they did because health professionals couldn't get them or there was a shortage on them, which is completely understandable. But if we are saving all of the PPE, such as masks, if we are going to be saving all of that for the health professionals, which obviously in this situation are not so much more important, because no one's life is more important than the others. I understand that they deserve or they should have them first. But If it doesn't help the spread of the coronavirus, then why do health professionals need them but the general public didn't? So with that said, I think it's a complete travesty that back in February, March, and April, people were criticized for not wearing masks, and then we were criticized for wearing masks. The Surgeon General told us not to wear masks, and the WHO, like I explained, has flip-flopped on their position. And finally, from October 12th, you have the WHO from news.com.au. Title of an article, Coronavirus. WHO backflips on virus stance by condemning lockdowns. Lockdowns have been used to control the coronavirus around the world. Now, a WHO official has questioned the success of them. The article states, and I'm going to read just the first couple of sentences. The World Health Organization has backflipped on its original COVID-19 stance after calling for world leaders to stop locking down their countries and economies. David Nabarro from the WHO appealed to world leaders yesterday, telling them to stop, quote, using lockdowns as your primary control method of the coronavirus. He also claimed that the only thing lockdowns achieved was poverty, with no mention of the potential lives saved. He goes on, quote, lockdowns just have one consequence that you must never ever belittle, and that is making poor people an awful lot poorer. Well, isn't that rich? After the WHO told everybody every single opinion under the sun, after they said we need to lock down, countries should lock down, it's going to help prevent the spread. And now here we are in October, 7 months later, and the WHO has the nerve to now condemn the lockdowns as if they never said anything about the lockdowns being a good thing. And now the whole talking point of the southern states that had less restrictive lockdowns and that opened up sooner than other states, this whole thing about we are going to experience this huge second wave, we're going to become the next New York, we're going to become the next New Jersey, we're going to become the next Michigan. Let me just let you know about Arizona's data on COVID-19 as of October 13th. Arizona's number of ICU beds in use by COVID-19 patients decreased to 146, down by approximately 85% from July 13th. The number of ventilators in use by COVID-19 patients is at 88, down by approximately 87% from July 16th. The number of inpatient COVID-19 patients is at 706, down by approximately 80% from July 13th, and Arizona's percentage of patients with COVID-like illness seen in hospitals is at 3.2%. So with all of those numbers from Doug Ducey's office, this is from on Twitter at 9th Floor AZ. This is Governor Ducey's day-to-day operations Twitter account. They share information every single day on COVID, and they let us know the numbers literally every single day. That's one thing I do have to give a hats off to Governor Ducey and the officials here in Arizona, is that they've kept us informed the entire time. There's been no cloak and dagger. There's been no wool over your eyes. There's been no messing around with us. They've been telling us what's up. When there's been a little bit of a spike, they've let us know. When they say, stop doing something, they let us know. And by giving us this data literally every single day, not every week, not every few weeks, not every few days, no, every single day, it should really help Arizonans and people around the nation know that here in Arizona, where we did not lock down as tough as some states, we are doing a great job in containing this coronavirus. And with these numbers, I'm just going to read them again. Arizona's number of ICU beds in use by COVID-19 patients decreased by approximately 85% from July 13th. The number of ventilators in use by COVID-19 patients is down by 87% from July 16th. And the number of inpatient COVID-19 patients is at 706, down by approximately 80% from July 13th. Incredible numbers. I'm very proud of the state and the way that they've handled it. I know recently, since I got back from a little vacation back to the East Coast, big differences in what's going on in New Jersey and what's going on in Arizona. I know that here people are still taking precaution. I did go to the store just a couple of days ago, and most people were actually wearing masks, which was a little surprising to me since we are more on the downside of this pandemic and the downside of cases and whatnot. It does surprise me a little bit that a few months ago, and I've mentioned this on earlier episodes, is that out of 10 people, you'd say maybe half were wearing masks. And when I was at the store the other day, A little surprising to me here in Arizona was that I do see more people wearing masks overall, and I don't condemn anybody for doing that. I will not knock anybody for doing that. You make your own decisions. I carry a mask in my pocket, and I don't even think about putting it on when I go into places. I am safe. I keep 6 feet away from people. If I don't feel good, I get my groceries delivered. It was a little surprising to me, but it is completely up to every single person themselves that out of 10 people, say, in the store, I'd say probably 8 or 9 of them were wearing masks, which is a good thing for those people if they feel that that's going to help them avoid contracting the coronavirus. But with so much misinformation, disinformation, and misleading from the WHO and the CDC and epidemiologists all around the world, it's been 7 or 8 months. We know a heck of a lot more on the healthcare side from doctors and healthcare professionals. We know a lot more now than 7 or 8 months ago. And with all of the data that is coming out, we should all start to move on with our lives and start learning to live with this coronavirus until there is a vaccine, which is not guaranteed by the end of the year or the beginning of the year, no matter what the president or no matter what the administration or healthcare professionals say. We are supposed to be entering a stage where we're getting close to a vaccine, and that's going to help ease people's minds. Obviously, with the election coming up, a lot can change with the vaccine and how we start handling this coronavirus. But with all of the data out and the WHO and the CDC flip-flop, and I've said it time and time again, but I think we should all start looking at the data for ourselves, start making informed decisions for ourselves based on our personal situations. And let's move on with this, because I feel the WHO and the CDC, no matter how much they've tried or how much that they've led on that they know, I really feel that them leading us on in so many different directions and twisting and turning on every single stance, it's been really bad for the nation overall, been really bad for the world overall. And I think if we take everything that they say with a grain of salt or a bag of salt, if you wish, I really think we should start moving on with our regular lives and getting back to normal and not a new normal. Thanks so much for tuning in. Don't forget to subscribe, rate, review, and share the show with your friends. Really helps spread the word on everything. Again, thanks so much for tuning in. Don't forget to subscribe to the podcast on any of your podcast platforms. Drop the show a 5-star rating and leave a review if you'd like. Again, share the show with your friends. Subscribe anywhere you get your podcast. Rate, review, tell your friends, tell your family, and I look forward to catching you back here on the next episode of The Fox Experience.